For 1.3, release and consent forms, this is a form we go over with the patient upon check-in. It basically, the computer fills out the information for the client and the patient here, and fills out the reason for the animals here. This is animals here for dental cleaning, so that's automatically filled in. This form gives us authorization to treat the animal, prescribe medications for, and to perform the procedure itself for that day. It also says that if the animal is found to have parasites while it is here, that gives us authorization to consent. You know, if it's found with fleas, we can give a Capstar and maybe a topical Frontline or a Revolution. At this point, we go over the nature of the procedure and the operation and the risks involved, and go over that the results cannot be guaranteed. It also understands that the owner is responsible for any fees incurred for the medications and for maybe any x-rays that are needed. Whether or not even they are still responsible for the fees in the event of the failure of the procedure or the failure of the patient to recover from the procedure or treatment. If the animal for some reason cannot be examined safely, it also gives us authorization here in this last section to administer anesthesia to help examine the patient. Assumes that the owner assumes all risks related to the administration, maintenance, and emergence from the anesthesia itself, since an exam could not be done safely before the procedure. And the owner would just sign at the bottom. Another form which is not in the computer yet, so it's still just a paper copy that will go in the chart, is this form. We would put in the client's name, the chart number, the patient's name, and the procedure being done that day. We would ask the client when the patient last had food and water, any problems or concerns a veterinarian should be aware of. These will be listed here. So one last chance for the client to state that maybe there's another issue going on that the client has been reluctant to talk about. Just one last chance for the client to state that. This first paragraph covers that the veterinarian recommends a blood profile to ensure that the pet is a low-risk category prior to anesthesia. It gives a price for the profile being done for a hematocrit, blood chemistry panel, and electrolytes. The patient can either say yes, or the client can either say yes or no, and the client would check off the box there. We do have a section here for that. A 40X test is required for any dog over 6 months of age, and what the 40X is testing for, gives a cost. Any cat that does not have a prior negative feline leukemia FIV test will also be done. And any pet over 7 years old, we encourage them to have the panel done before the anesthetic is given. Also, here is a chance for the client to authorize us to microchip the pet while it's under for the procedure. Gives a cost for the chip, and they can check yes or no. We do all the online registration for the client if they do have us do this. There's also an option here that is highly recommended for the patients, is an IV catheter placement. There's a cost for that listed, and it basically, we inform the clients that it gives us easier and faster access to administer any drugs during an emergency situation. We highly encourage it, and the client has a chance here to either say yes, they would like to have it done, or no. Also states here that we may give IV fluids if the patient has a catheter in place during the procedure, and a fee for the fluids itself. Also a reminder here that although we take every precaution to ensure the pet's safety, there is a risk associated with any anesthetic procedure, and then the client can sign here and we date it there.